All right. Good morning. You're welcome to our today's class. We are still. Please silence your phones, please. Please silence your phones. Class rep attendance, please. Okay. Good. I noticed that some of you, while writing their name, they wrote it in such a way that to read that name is something else. Please, if you know that your handwriting is not that wonderful, use capital letter. Is that clear? You know, small letter has a way of making some writing to look funny. But if you use capital letter, it will stand out. Please, you use capital letter, please, I beg you, so that I will be able to read your and understand the names. All right, so we are still on the course BDT 351. BDT 351, Basic Dispensing Theory 4. In our last class, we concluded with the topic creams, right? And we answered some questions, right? Yes. And the questions are not difficult, very simple questions. Very, very simple questions. And I believe you will scatter the questions in exam. Yes. They are simple questions. So without wasting time, today we go over to ointment. Today we go over to ointment. I hope you are studying, Please, there's no time. Maybe by next week or so, we'll write our first quiz. Quiz, yes, quiz. Quiz, Q-U-I-Z. Quiz. Test. Until then, we know whether it's online or offline. Are we together?
Yes, sir.
All right, so we look at ointments. So each time you hear the term ointment, what comes to your mind? Any idea? Share with me. Let me know what you know about ointment. Share with me.
Semi-solid.
I agree with you. What else?
I used for the skin. It was an external application.
I agree with you. It's external. Do it in my class. Please, you had since 8 a.m. till now. You not eat. Immediately I enter class, you started eating. What type of a near student are you? Alright, continue. I'm listening. Okay, help me out. Sussex. Oh yeah, help me out. All right, so let us not waste time. Ointment are semi-solid formulations applied to the skin or mucous membrane. They are what? Semi-solid what? Formulations that apply to the skin or what? The mucous membrane. They usually use anhydrous bases. Anhydrous bases. They usually use what? Anhydrous bases. I'm not calling no to. I said they apply to where? Skin or mucous membrane. Are you aware? There's somebody says something now, and the person stopped at skin. It's not just the skin alone. We have eye ointment.
Yeah.
Eye ointment, eye ointment, right? Yes. Does it get in contact with the skin or the mucous membrane? Lining the what? Right? And another mucous membrane in question. So it's not just about the skin alone. Is that clear? So that's the point I want to make here. Apply to skin or what? Even mucous what? Membrane. And their base are usually anhydrous. You know what anhydrous means? If something is an anhydrous, you know what it means, right? Water free, right? At least there's no entrap to what? Water free. And they may contain one or more active ingredients. They may contain one or more active what? Ingredients. And these ingredients are dissolved or suspended in the base. The ingredients are dissolved or suspended in the what? in the base. So what are the purposes of what? Ointment. So the ointment serves several purposes. Some of them are as follows. They are there to moisturize what? Dry skin. They moisturize what? Dry skin. That is emollient what? Effect. Are we together?
Yes, sir.
They moisturize what? Dry skin. And they also protect what? Damaged what? Skin. To protect what? Damaged skin. And in general, they are also there to deliver medications topically, generally, topically. Is that clear?
Yes, sir.
Now, what are the commonest or common drugs? Let's look at the common drugs or commonest, any one you can use that can be added in pharmaceutical ointments. You see things like anti-acne drugs, right? Acne, ACNE, acne drugs. Yeah, drugs like sulfur. There are some ointments you see sulfur. Who can tell me anyone you've seen in the shelf? Generally, the one you see in the shelf. You went for your C-word. Talk to me. Don't keep quiet here.
Containing sulfur. Other ointments.
Do one that contains sulfur. Which one? Sulfur what? Ointments.
They're not sulfur.
What is the common brand name you see around in almost all the pharmacy? Very common. You see it in almost all the pharmacy. Aquasoft. People that went for CWS. So sulfur ointment BP. That's the what the generic name. Sulfur ointment BP. British what? Pharmacopoeia. So it's now we also have the one that contain what? Resorcinol. Please, at this point in time, do not joke with your. Try to know as brand name as possible. In fact, don't look at medicine now in the way you are looking at it before. Any medicine you see, find out what is the brand name, what is the generic name, what is the drug inside it. Then you go to the pharmacology of that particular drug inside it. Before you know what's going on, you will learn a lot. Don't allow a day to pass without you adding to your library of drugs or medicines, at least one every day. Before you know what's going on, you don't even know when you know as many as what possible. Please, let's go practical now. It's not just about theory. Let's now start reasoning like that. Even if you are walking on the street, you see a packet of drug, don't just pass. Look at it again. Find out what that thing is. Is that clear?
Yes, sir.
Yeah, it may be so dirty for you to touch, but at least you can use your leg and push it out and look at it. Find out what it is. Please try to grab every opportunity you seize every opportunity to learn one or two about what medicines. Is that clear? Then we have the one that are antibiotics. The one that contains antibiotics. Yes, we have some antibiotics that can be formulated as what? Ointment. Like neomycin can be formulated as what? Ointment. Even bacitracin, chlorotetracycline, even chlorotetracycline, even chloramphenicol, even chloramphenicol. That one is common. We have chloramphenicol eye ointment, right? Eye ointment is there. So it's not just about skin ointment alone. We also have eye ointment. So there are many of them. So it's not limited to what I'm saying here now. You can research more. I cannot say everything here. It's not possible. True of course. In fact, if I start talking about all the drugs in ointment form, a whole semester will finish. True of course. So try to. What I'm doing here is to lay foundation. You go. That's why I want my students to study hard. Study. Don't just limit yourself to what you are doing in class. Develop yourself. Is that clear?
Yes, sir.
So if you are interested yourself, you can chat me up. I'll add you into the Telegram channel where you can access any textbook you want to. Pharmaceutical textbooks. It will help you a lot. In as much as I'll give under because of where we are. But it's important you develop yourself. Is that clear? Yes. If you chat me up on Telegram, then I'll add you up in the channel where you have access to different textbooks. Is that clear? It will help you to develop yourself. Are we together? Good. Now, then we also have some antifungals can also be what? Formulated as what? Ointment. We have benzoic acid. Benzoic acid is also formulated as what? Ointment. Antifungal. We also have salicylic acid. Who have seen Whitfield ointment before? What does it contain? Wagan. Those that went for IT. Oh, talk to me. What does Whitfield ointment contain? Give me. What does it contain? I won't tell you. By now you should not listen. Oh yeah, talk to me. You must tell me before this class ends. So better start with researching now. You must tell me by from your mouth. You must open your mouth and say it.
So I learned about it.
What is it?
Benzoic acid.
God bless you.
Acid.
And what?
Salicylic acid.
Good. Have you seen salicylic? So I just mentioned benzoic acid and salicylic acid now. Is that clear? Is that what? I can't hear you. Okay, good. Even eczema too, right? Mm-hmm. Then anti-inflammatory drugs can also be what? Formulated as what? As what? Ointment. We have triamcinolone, acetonide. We also have betamethasone valerate. There are many of them. There are many of them that can also be formulated as what? As what? Ointment. We also have the one that takes care of itching, right? There are many of them. Benzocaine is also formulated as what? Ointment. Benzocaine, even coal tar. Then we have the one that can also be used. So some of these things I'm calling now may be function as this as I said, I have function in the other class. Is that clear? So that they're not restricted to the place I mentioned, just as she mentioned now. Wait, what? Field. Then we have the one that can be used to treat what? Psoriasis, even salicylic acid. Are you aware that Aquasoft can be used to treat psoriasis too?
What's psoriasis?
You're asking me what's psoriasis? I don't answer direct question. Browse it. I only explain to my students. You can't be asking me what is psoriasis. So I'll sit down and start telling you what is psoriasis. When some words are mentioned, that's why I encourage you to come in my class. Feel free. Be with your what? Device. There are some things I will mention. You don't even need to ask me. Check it up. You are studying at the same time. Is that clear? So what is okay? The spelling is the issue. Okay, sorry. Now I can give you that one. So what? So I can give you that one. So sorry. So what is it? I can't hear you. Can you hear her? No.
A chronic, non-contagious autoimmune disease that causes the body to produce skin cells too quickly.
Okay.
Leading to build up of red, scaly patches on the skin, joints, or nails.
Good. Aquasoft can also be used to treat what? Who has seen a package of a packet of Aquasoft? You see the patch, right? Yes. See, I look at that to me. Please, I beg you. I hope by now, after school or even during weekend, you have a pharmacy you go and just to go and gist. If you don't, please look for, even if not to work for them, at least go there and be gisting. Make them friends. See what I mean? See what I mean? See what I mean? See. Oh, see what I mean? Oh, all year children of nowadays, you don't know how to make a positive link up. Most of the link up you make are the one that will mess you up. You know how to link up with what will help you to grow your career. Is that clear? Find out. There must be, it mustn't be one. Find out. Just go there, make them friends. The same way you make people friends, just make friends, help them, just do one, two things and go. You're not going there to be paid or whatever. You're not going to just from normal greeting to where is your linking upstairs? Where are they? Channel them in the right direction. Only what? No. See, no. No, you can. You can. Start from the one around where you're living. That's the problem. It's like this now. If you like this, hello. If you do like this, you bring your own down. If their own is like this, if their shoulder is like this, and your own is like this, it will not work now. You will be doing what? You will be having issues. Bring your own down. See. Listen to me. I'm telling you. Listen to me. I'm telling you what I did. As a student, you don't need your lecturer to do it for you. See, there's something this generation is lacking. Listen carefully. There's something this generation is lacking, and it's a problem. You channel energy in futile things more than what will help you. It's a general problem. I'm not only here. It's a general problem. Even if it is not one person, two person, you can start from buying things. You can start from buying something. Wait, listen. All right, now stay in your house and waiting for your HOD to do that. It's your, who else to pay for money? Oh yeah, now stay in your hostel now. Stay in your hostel. If they ask you to pay money, so you just so what did you tell the person? Huh? See the problem. See. Hello. The problem I noticed. Even few seconds, few minutes, few days I'll be here. Some of you are too foolishly arrogant. I know what I'm saying. Listen carefully. What I've noticed, some of you are foolishly arrogant. That's a fact. Some of you will see, even see your lecturers, they'll be passing. Listen carefully. I know what I'm saying. What I'm saying is reality, and it's a problem. Some of you feel like, why would I go and start HOD sugar? No, get humiliated and get what you want. What you want is your driving force, not what the person is saying or doing. The moment that even that complex to even go is your problem, sir. So I know what I'm saying. Yes, sir. Do you know that by just you target being friends with these particular people, maybe be it pharmacy, be it pattern medicine, anyone is okay. It doesn't be pharmacy. Is that clear? Your target is to be, your mission is to be friends with this particular people. You start from even if you don't need vitamin C, you buy. Greet, pass. Introduce yourself. I'm so personal. I am a student in this place. This is my field, so I just like what you are doing. Pass. Next time, go around. Just bring up a topic, discuss it, go. Before you know what's going on, your face is becoming common in that familiar in that place. When you now start the what is it called? The defense system is down. You penetrate, and before you know what's going on, you may even start from by offering help to do one or two things. Before, you may have one skill or the other, just offer it, do it, and go. Before you know what's going on, you may start sitting there once in a while and go. Give this thing I'm telling you now work within 2 months. It's working. It's not magic. But if you just work, I'm so the person, I want to come here and learn how to work. They ask you to pay. I want to learn how. You pay now. Which one you want to learn? You pay for learning. You can't just come from the what help have you offered them? No, tell me. Who gave you that entitlement idea? What help have you offered them? From nowhere. Because you're a student, is it enough? I want to learn how to. You pay. You are one matters a lot. Am I communicating? You are one of our approach matters a lot. What have you offered them? Ask yourself, what can I offer these people? Ask yourself that question. So some of you think that some of you are entitled because you are not a former Christian student. Anywhere you go, they should be able to allow you to learn. You will pay. Fine, if you have the money to pay. If you have to pay, you pay. It's okay, normal. But if you don't have the money, or God, humble yourself. Money you don't have, pride is your own. You are poor. Another. Wait, you are broke. Wait. You are broke. You are ignorant. You are arrogant at the same time. Which one is a problem? Please, let's continue, please. See, these things will help you grow. You appreciate what you are doing. Each of these things will be mentioned. Even in your AUM, you go and look at those medicine, see how they look like. It will help you. Then get your MDEX too. Get your MDEX. Hope you have access to MDEX here. Yeah? Get your MDEX. Okay, so let's look at the base. You know, as I said, basis. Most of these preparations, these semi-solid preparations and some liquid, their base is very important. Base has a lot to do with what the final product will look like, even the effectiveness. So the base is very important. So let's look at the classes of ointment bases. Let's look at classes of ointment bases. We have hydrocarbon bases. We have hydrocarbon bases. We have absorption bases. We have hydrocarbon bases. We have absorption bases. We have water miscible bases. We have water miscible bases. Then we have water soluble bases. We have water soluble bases. So let's look at a bit detailed hydrocarbon bases. So from the name, you don't to be told again that hydrocarbon bases are hydrophobic, right? They are what? Hydrophobic. They don't like what? Water. They are water repelling. Is that clear? So they are hydrophobic. Now, this thing actually helps them a lot, to form protective layer on the skin. So they form protective layer on the skin. They form protective layer on the skin. They form protective layer on the skin. So let's look at examples. Features of this. Let's look at the characteristics of this hydrocarbon bases. Let's look at the characteristics of the what? Hydrocarbon bases. So, I said they are what? They are what? Yeah. Now, these hydrocarbon bases, they have occlusive properties. Occlusive. They have what? Occlusive properties. That means they prevent loss of what? Moisture. They prevent loss of what? Moisture. They are not absorbed by the skin. They are not absorbed by the skin. And that property is that they are sticky and greasy. They are sticky and what? Greasy. Who have used ointment here, right? Before. So some of the bases are what? Sticky and greasy. Good. Another property is that they are chemically stable and inert. They are chemically stable and inert. In fact, they are commonly available. They are commonly available and what? Relatively cheap. They are commonly what? Available and what? Relatively what? Cheap. I said they are commonly. Look at this one. He always want me to call notes for you, right? Child. Why did you come late today to class? Why don't you stay in hostel? What happened? Since your house is far. So if your house is far and you stay in hostel, right? So you can be close to school. Huh? So had it been I chase those that come late, now you will be outside. So they have poor water absorption capacity. They have poor water absorption capacity. Are you with us? Hello? Are you with us? Are you with us? No, you know what are you writing?
I'm writing what you're
No, you're looking at your phone. What I was seeing. Come here. Let me see what they are writing. Whether you are in another class. Alright, I said that they have poor water what? Absorption what? Capacity. So examples of hydrocarbon bases are soft paraffin. Soft paraffin. As in soft now, soft versus hard. Soft paraffin. In fact, soft paraffin is the main base in many ointments. Not all ointment, but majority of ointment. Is that clear? Soft paraffin. Then we have another one, hard paraffin. Hard paraffin. So for the name now, you know that the one that have hard paraffin will be a bit what? Stiffened, right? Right? From the name hard paraffin now, as against soft one, the one that has hard paraffin will be a bit what? Stiffened. I hear that there are some you press. Just get penicillin ointments or some other ointment. There's one you press, it looks as if it's very hard. Have you noticed that? Yes. So they use hard paraffin in those ones. Then we have what? We also have the next another one is liquid paraffin. I've mentioned soft, I've mentioned hard. This one is what? Liquid what? Paraffin. This one have an improved what? Spreadability. So it improves what? Spreadability. You know what spreadability is, right? Spread from spread. Spread what? Spreadability. Then we also have a mixture, the one that comes as a mixture. We have that one is paraffin ointment BPC. Paraffin ointment. So they can use paraffin ointment BPC on its own as a base. Is that clear? Is that clear? That means you are prepared. It is prepared first as a mixture before you cannot use it. Is that clear? Paraffin ointment what? BPC. Paraffin. What is the meaning? What is the full meaning of BPC? Huh? I can hear two things now. What I hear from here is different from what I hear from here. What do you say now? British Pharmacopoeia Codex. Thank you. I heard something else here. British Pharmacopoeia Codex. Are you sure?
Yes. CODEX.
No. I'm just saying you did this for the first time. Throughout my life, as a student and as a pharmacist and as a lecturer, what I know is that BPC is British Pharmaceutical Codex, not British Pharmacopoeia Codex. We have BP is, hello, BP is British Pharmacopoeia, that one day. But for BPC, what I know and what I have seen in all my years as a researcher and whatever is British Pharmaceutical Codex. Where did you get that one from? All right. Please, hope you've taken the correction.
Yes, sir.
Let's continue. All right. Let's look at the second classes of basis. We have absorption basis. Absorption. From the name alone, you know what happens now. This one absorbs. Listen carefully. You know, some things can absorb water and dissolve in it. Some can absorb and disperse in it. Hope you know. Some can absorb and just swell. So these absorption bases, they absorb water and form emotion. Is that clear? So absorption bases, they do what? They absorb water and form emotion. Are we together? You're copying notes. Come. Let me help you. Come. Bring that phone. I want to help you. Just the phone alone. Keep it. Go and sit down.
This is the British attendance. But it's what
this thing you are doing, you can listen carefully. This thing you are doing here. Hello? Are we together? Please, if you are in class, if you, in as much as I allow you to make use of what your device, but please, if you are in class, unless you are asked to search, you can search. Calm down. You can always do this at any point in time. You can always ask Chat GPT anything you want to ask any point in time. But when you are in class, just keep it and listen. Just follow the class first, because there are some things I will be describing here that you may not see the way it is there. Is that clear? There are some things that I may describe out of experience, which is not there, and you miss those ones because your mind is looking at what is there. You are distracted. Okay, just listen. After you can do that one you are doing. Okay, just listen. If you are the type that cannot write, that cannot jot down, you can record and then listen. You can be playing, you can be recording it while you listen. That forms your residual knowledge. Till today, the former vice chancellor of Nandaziko University. By the time if you come up as a pharmacy technician or a pharmacist, you start knowing who is who in pharmacy. Professor Esimone, his name is Professor Esimone. These are men in pharmacy. These are men. You know, in every profession we have men. These are men. The lecture, if he enters your class, you just be teaching. You are only to listen. What I heard him said in class, how many years ago? That was I was in my second year in 2000 and I was in my second year in 2006.
I got it 50 years ago.
Listen carefully. 2006 to 2009 is how many years ago? 19 years ago. I was in second year pharmacy school 2006, 2007. What he entered the class to teach is still in my memory. The way he was describing it in class, everything is playing before me now, like a recorded movie, like a movie. Why? Because the day he came to teach us virology in pharmaceutical microbiology, when he was teaching, everything he was saying that day is still playing as I'm teaching you now. I'm seeing him, the way he dressed that day, what he was saying that day. Why? That day I was just listening to him. I was just listening to him. These things I'm saying now form your residual knowledge. It's not what GTP say or the notes or handout. No, is that one you see? You are in class and the lecturer is teaching. That's why I say if you cannot put down something, or maybe if you're putting down distracting you, record it. I can allow you, keep it, but listen. As I'm talking, listen to me, hear me out. By the time you know, after here, you'll be surprised that whatever I'm saying here, you will be playing in your memory. But that's one thing people miss, especially those that don't even come to class. They are empty. I'm sorry to say it, but they are empty. You may cram hand out and go and pour and pass. But you say you know you are empty. There are some places you don't want to go. There are some things you hide because you know that something is lacking somewhere. But here I am, my head is up. Sometimes I put my, if not that I don't trust the power system. Sometimes if I'm in class, if you watch my lectures online, if you go to my channel, most of my lectures are live. As I'm teaching here, it's live. Anyway, you can watch it. Why? I am not afraid of what I'm saying. I don't know it all, but that what I'm saying, I'm not afraid of it. If you think it's wrong, come, let's talk about it. Record it. Go to any place, play it. I'm proud. My lecture is scattered everywhere, and I'm not afraid. Why? I know the men that taught me. These are men. It's not just anyhow people. Men of timber and caliber in pharmacy. I'm not talking about money. I'm talking about people that have something here. So if you are in class, you are distracted by things. No. You are not helping yourself. Focus. Listen. When you now go back, you can do more research with your chat GTP. Play anything you want to play. Do anything you want to do. Please, in class, listen. Not just by my course alone. In any course you are doing. If I'm in class, I don't do anything. I just sit down and listen. Because I know that is entering my subconscious mind at that point in time. So please, let's take that correction. So I'll keep this here to help you, so it doesn't distract you.
Thank you, sir.
Let's continue. So I say that they absorb what? Water to form what? Emotion. Is that clear? Specifically, oil in water, emotions. Oil in water, what? Emotion. Sorry. Just emotions. There are other ones under this absorption base. If I go there, I will now specify the one that is oil in water and water. But just know that in general, absorption bases absorb water to form emulsion. Is that clear? So these absorption bases are subdivided into two. They are subdivided into two. We have the ones that we call non-emulsified absorption bases. Non-emulsified absorption what? Bases. Are we together? So this one, they can absorb water to form oil in water emulsions. Non-emulsified one can absorb water to form what? Oil in water emulsions. Is that clear? These ones are very good when it comes to incorporating aqueous solution. They are good for incorporating what? Aqueous what? Solution. I say that they absorb water to form what? Oil in water what? Emulsion. And they are very good for what? Incorporating what? Aqueous what? Solutions. They also help oily drugs that are normally they are oily. Is that clear? They also help oily drugs to be able to penetrate the skin. They help oily drugs to be able to penetrate the what? The skin. Is that clear? Good. Examples of non-emulsified absorption bases. Examples of them, we have wool fat. Wool fat, or simply anhydrous lanolin. Wool fat or anhydrous lanolin. Lanolin. Wool fat or anhydrous lanolin. They also have wool alcohols. Wool alcohols. They also have wool alcohols. They also have beeswax. Is beeswax natural or synthetic? Natural. I've asked you up to 20 times or 10 times. Is it natural or synthetic? Natural. God bless you. Let's continue. So the next subdivision here under absorption basis, we have water in oil emulsified basis. Water in oil emulsified basis. Are we together? Are we together? Are we sure? Please, let's be you. I'm coming. Okay, let's continue. So this one now, this one normal, this one on the normal, they already contain water. This one already contain what? Are we together? Are we together? Huh? Okay, you want to take okay, so I said that water in oil emulsified basis, these ones already contain what? Water. So they cannot absorb what? More. Is that clear? They cannot absorb what? More. They already contain what? Water. And they are good emollients. Know that point. These ones are very good what? They are good what? Emollients. Examples of them, we have what? Hydrous wool fats. I don't know whether I'm the one delivering lecture or this fan. Is it the fan that is delivering the lecture on me? No, you're making the noise is too much. No, All this one.
6 years, don't know the family.
All this one. 6 years, kwa. God forbid. Reject it. God forbid. 6 years. God forbid. Reject it. Do like this. Throw it to this side. God forbid. 6 years. Ha. All right, let's continue. So, example is hydrous wool fat. Hydrous wool fat. Hydrous what? Wool fat. So, lanolin. 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 Yes, example of what? Huh? What happened now? You see this nut gone off. Please know the difference. So the one under is just wool fat. Ordinary wool fat. Don't mix them up. That one is ordinary what? Wool fat. That's why it is called what? Anhydrous lanolin. But the one under water is now what? Hydrous wool fat. Just what? Lanolin. Please know the difference. Now, another example is oily cream BP. Another example is what? Oily cream. Silence your phone, please. Oily what? Cream BP. Oily cream what? BP. Now let's look at water miscible basis. Water miscible basis. Water miscible. So from the name alone, you know. Miscible. As in, it can miscible. Can you see this spelling on the board? Water miscible basis. These ones are very easy to remove from the skin and clothes. They are what? Easy to remove from the what? Skin and what? Clothes. This one now form oil and water emulsion. They form what? Oil and water. We are looking at water miscible basis. They form oil and water emulsion. In fact, they are preferred when it comes to cosmetic and dermatological what? Ointment. Is that clear? So they are preferred for cosmetic and dermatological what? Use. Dermatological. They are preferred for what? Cosmetic and what? Dermatological use. Examples of bases under here. If we understood what we discussed in cream, then you will see a kind of repetition here. Here we have the examples there. The first example I want to mention is what? Emulsifying ointment BP. Emulsifying ointment BP. This one is anionic. This one is what? Anionic. Emulsifying ointment what? BP. And the example is what? Cetrimide emulsified ointment. Cetrimide. Cetrimide what? Emulsifying ointment. This one is what? Cationic. Cetrimide emulsifying. Remember what we discussed about in cream. Remember, cetrimide emulsifying ointment. This one is what? Cationic. Then we have cetomacrogol. We have cetomacrogol emulsifying ointment. Any issue? Cetomacrogol. How many times? Cetomacrogol. What's another name for macrogol? Bagam. Another name for macrogols. I said it. I discussed it in this class. Poly what? You're a near student, but you are trying to leave that space. Don't worry, you succeed. No, she's struggling to leave that category, but some are relaxed there. Don't worry, before the end of this week, I will pull a lot of near students out from that situation. Is what? Polyethylene what? Glycol. Polyethylene glycol or PEG. Simply PEG. They are called what? PEG. There are many of them, but the class is known as what? PEG. Polyethylene glycol. So cetomacrogol emulsifying ointment. This one is non-ionic. It's non-ionic. So when you have your material, you sit down and go deeper. Is that clear?
Yes.
Is that clear? Yes. Then we have another class where we're going on water soluble basis. Water soluble basis. That face is familiar. Is she one of us? Why are you moved? Come here. Hello. What happened? Caller. Why are you mufti?
They're talking to you now. Oh.
Okay, she didn't come to school today.
No.
She going to say hi.
Yes.
It's well. Let's go. Focus. Let's continue. My students are in school uniform, right?
Yes.
These are my students, those in school uniform. Let's continue. Alright, so I say, hey, focus, you. Leave joy alone, you. Leave joy and focus. Listen to me. Water soluble what? Basis. So let's look at water soluble basis. So from them, you don't be told what happened. Is that clear? This one, they do not contain oil. Water soluble basis. This one do not contain what? Oil. And they are fully water what? Soluble. They are water soluble. In fact, they are mostly made from macrogals. They are mostly made from macrogals. They are mostly made from macrogals. AKA macrogals is what? Polyethylene what? Glycol. Polyethylene glycol. So they are mostly made from where? Macrogals. So they are non-greasy, right? They are non-greasy. So please know that point. They are non-greasy, and they wash off easily. Sorry, they wash off what? Easily. They wash off easily, and they are chemically stable. But the issue they have is that they absorb little water. They absorb little water. I said they wash off easily. They are chemically stable. Yes. Then let's look at the issues they may have. They absorb little water, and they may irritate the skin. They may irritate the skin. They may irritate the skin, and they have the potential to interact with some drugs. So they can interact with some drugs. Now remember what we're talking about, since is just we are talking about basis, right? We were talking about basis, right? So now let's look at some additives. Understand the direction this topic is going now. We talked about purposes of ointment, right? Then we talked about the active ingredients that you can see in what? Ointment. We listed some classes, right? And examples. Then we now go to the what? Basis now. So we are dissecting ointment now. We move to basis, right? Now we are looking at some additives that you can find in what? Ointment. Hope you understand the direction the lecture is going. So that when you get your material to study, it will be easy for you to understand. Is that clear? That's what we are doing here. Are we together? So that's why I want you to listen. If you understand what I said in this class, if you have even if the hand have like, let it be 500 pages. Once you open it, you grab it easily. Is that clear? That's what we do. We have no other job. So let's look at additives in what? Ointment formulation. So why do we use additive? We use additive to be able to do what? Improve the quality of the what? Formulation. That's what they do, basically, to improve the quality of the what? Formulation. So we are going to look at, I'll mention each of the additive, then talk about the purpose, then talk about, just give at least one example of each of them. Is that clear? So the first additive I want to talk about is vegetable oils. Vegetable oils. Vegetable oil. So why do we add vegetable oils? Vegetable, yes. So why do we add them? To soften the what? Ointment, and to do what? Improve spreadability. To soften and to do what? Improve what? Spreadability. That's why we add them. Examples: we have olive oil. We also have coconut oil. So olive oil and coconut oil can serve as what? Additive. Is that clear? In ointment. They are there to do what? Coconut oil. Then we also have synthetic esters, another group of additives. Synthetic esters. Synthetic esters. Synthetic SYTHETIC. Synthetic esters. These ones are stable emollients. Is that clear? Stable what? Emollients. Remember the importance of emollient, right? Remember, right? So they have emollient what? Properties. Is that clear? But they are stable. Example is isopropyl myristate. Isopropyl myristate. There is state. Hope you can see the board.
No, sir.
Can you see it now?
Yes.
Then even higher fatty alcohols are also there. Higher fatty alcohols. Higher fatty alcohol. Fatty. These ones are added to improve texture. To improve what? Texture. Higher fatty.
So I just an example of additive.
Yes, another class, another group. Higher fatty alcohol. Yeah. No, another group of additives. Remember additives, their purpose and examples. We are done with synthetic esters. Okay, I'm talking about higher what? Fatty alcohols. Yes, myristate. Yes.
And examples.
Yes. As an example of synthetic ester used for their emollient property now. I'm coming. That I want you to get settled in synthetic. Okay. Higher fatty alcohols, they improve texture. Improve what? Texture. Higher fatty alcohols improve what? Texture. Example: cetostearyl alcohol. Cetostearyl alcohol. Cetostearyl alcohol. Then we have silicones and silicones. Another example of another group of additive types here. Silicones. Number 4. Okay, sorry. Number 4. Let me number it. Number what? 4. Is it okay like that?
Yes.
Silicones.
Silicone.
Yes. This one serves as water repeller barrier. Water repeller repair barrier. Water repair barrier. Water repeller barrier. Sorry, water repellent barrier. Sorry, not peller. Repellent barrier. Adjective. Water repellent what? Barrier. Not peller or Javi, so leave those ones. Barrier, bro, Maria. It's not Maria. It's not Maria. I say barrier. Example is dimeticone or dimeticone. Anyhow you want to pronounce it. Dimeticone. Dimeticone. Then number 5 is organic solvents. Organic solvents, they are there to enhance solubility.
So number 5.
Yeah, 5. Organic solvents are there to do what? Enhance what? Solubility. Enhance what? Solubility. Example is propylene glycol. Please, it's not polyethylene, no, it's propylene. Propylene what? Glycol. Propylene glycol. Just leave it like that. I don't want to go into IUPAC. Just take it like that, okay? You know, if you start going into IUPAC, a cake name, they may turn out to just be the same. But let leave that propylene what? Glycol. Before I start going to organic chemistry now. And if I enter there, before I come out for that place, it will be 1 o'clock. I know myself now, so I'm trying to control myself. Now, another thing I want us to discuss under this topic is, let's look at desired qualities of a good ointment. So let's look at some qualities a good ointment should have. So desired qualities of a good ointment. So let's look at. So that means as you are now, if you see an ointment that have something that is opposite to any of this, then something is wrong somewhere. While doing the formulation, is that clear? You know you may have a wonderful, of course, most times active. Who is that near student there? Assistant lecturer. We may have all of us now. This is company A, this is company B. These two companies may have the same. In fact, these two companies may source active ingredients, maybe sulfur or benzoic acid, as case may be, from the same company. Two of you may have company A, company B that formulates ointments. Somebody is distracting. I'm saying something important here. Just listen, please. Listen, please. Company A and company B, they formulate ointment, right? The two of them may be sourcing benzoic acid and sulfur from the same company. But when they now come back to their company to manufacture ointments, the way you manufacture your own may give you an edge over his own products.
Yes.
His own may not work.
Yes.
But his own may work because of what? The type of excipients and how he formulated his own. The same way, two of you now, and they give you the same. In fact, three of us may go to market. Every ingredient for soup, we buy the same ingredient, the same quantity. Two of you, I will be there, the same person giving you the same quantity. You may go home to prepare the same soup. Your own may be very delicious. Pams.
Yes, ma'am. Good afternoon, ma'am.
His own may be very, very what? Delicious. Her own may very, but your own may be the same ingredient is scales, right? Is what? Scales. So now you may end up preparing formulating ointment that may not be that wonderful. So you should know the desired qualities that a good ointment should have, because this is quality we go away along with determining how the ingredient is what active ingredient is what released. Are we together? Yeah. And how the patient accept that particular what ointment. Are we together?
Yes, sir.
So now, so a good ointment should be smooth. It should be smooth, uniform, and free of lumps. A good ointment should be smooth, uniform, and free of what? Lumps. LUMs. And it should be non-gritty. What is non-gritty? So someone should tell us. If you don't know, look it up fast. What do you understand by the term non-gritty? If you know it, tell us. If you don't know it, look it up and tell us fast. Particles, okay. Any other idea? God bless you. Smooth. So it should be non-gritty now. That's the point I'm making. Is that clear? All those things gearing towards non-what? Gritty. I say it should be non-gritty. I'm giving you one thing that I compare now everything I've been saying since. Being smooth, uniform, and what? It should be non-gritty. No lumps. Is that clear? See it on the board now. GRITTY. It should be stable. You are number. It should be stable. Am I calling note here? I say it should be stable. Without phase separation. So there should be no phase what? Separation. So if you do nonsense, there will be phase what? Separation. They already passed. Yeah. Some of you cook egusi that have phase separation. In fact, if your egusi has phase separation, you don't know what you are. If you are oil of egusi, if you are a woman, if you are a cook here, if you cook here, any day you cook, any day you make egusi soup here, whether in your hostel, at home, and your oil is on top of your egusi soup. Before you dish, you turn the thing. That is not a good egusi soup. It's a very bad emotion, and that is how your emotion will look like when you do your practice. If you don't do it well, you separate. That's what's called phase separation. The egusi soup is a typical emotion in food you eat. Wow. It's typical emotion. Those in group B, those in group A, we, because of the time we had only 30 minutes, we couldn't go deep. But those in group B, we went deep into the theory of emotion and everything. We described it how you can use wet gum and what. And I told you how you can prepare egusi using wet gum method and the dry gum method, right? Yes, I just use that to explain to you what it means. So if your egusi has oil separate, it's a bad. You not cook it well. Do you know why? Why you know? Do you know the test that you don't cook it well? When you want to dish it, you force to do what? Turn it. But there's a egusi soup you make. If you look at it, you don't even need to turn it. Just because everything is. It shock you? Yes. I mean, that's my best soup. So please, but in general, emotion you shake it up, you know. General emotion shake it. So let's just look at. Let me just. I've told you the general methods of preparing emulsion. It has a link to emulsion too and cream. Are you aware? So I will just tell you straight. Just in practical we go deep, okay? In practical we go deep. So we don't waste our time here. Now, thank God we do ointment as a practical work here. Now, let's look at just briefly method of ointment preparation. There are two main techniques. Two main techniques we look at while preparing ointment. We have fusion method, fusion technique, fusion. Fusion, fusion. So for the term fusion, you know what it means now. You are bringing them together. No trying to make this one dissolve, or you are bringing them together because they can easily dissolve on their own. They are soluble. Is that clear? So this one, in this one now, the ingredients are just melted. Here, you melt the ingredient and mix. Is that clear? Of course, when mixed now, you should obey the proper way of mixing, which we have already discussed. It comes up here too. So here now you do what? You melt and do what? Mix. Is that clear? That's basically what happens. Is that clear? Every explanation is built on this. This method is ideal for ointments with soluble drugs or waxy bases. Please, this one is very important. It's good for what? Ointment that have soluble drugs and also waxy what? Bases. Waxy bases and what? Soluble drugs. This one you don't need to titrate. Is that clear? Is that clear? Fusion method. Just melt, dissolve and do what? Mix. And you're good to go. Melt, dissolve and what? Mix. Remember we have two phases, right? So you can also, another technique you can employ is titration method. Titration. You can employ titration. So we have hammered on titration so many times. So I'm not going deep I'm not going deep into what? Titration again. We have hammered it in several occasions. So here now basically you do what? You finely ground it, the ingredient, right? You ground the ingredient, then mix them with the base. Is that clear? You finely ground and what? Mix with the base. This is mainly used for insoluble drugs. Mainly used for what? Insoluble drugs. Mainly used for what? Insoluble drugs. Okay? So how do you package and store ointment? How do you package and store ointment? Ointment can be packaged in jars or collapsible tubes. But collapsible tubes are more common. True of us? I should come again. He said I should come again. Okay, let me come again. I said that ointments are packaged in jars or what? Collapsible tube. Which one is common? Yes, there are many of them in the market. True of us? Collapsible tube are what? Common. Tube. You know your normal tube now. Who has seen sulfur ointment BP? It's that tube now. Press it. That tube that look like your toothpaste tube now. That what you call. Didn't you do containers for the dispense product in your first year? Please, you have to read. Let me give you some. There's something I want to tell you. Please listen carefully. Listen carefully. Now that council exam is now CBT, it's no longer business as usual. It's you and your system. It's no longer business what as usual. So a lot of things have changed. So you have to take it seriously. Forget stories they told you before the last set. Don't worry. It's not that. Don't worry. It's no longer as easy as it used to be. Now take it seriously now. What am I saying? Thank God you have curriculum here. Please, don't limit yourself to whatever any lecturer comes here to talk and go. Take your curriculum. Make sure you have this curriculum. Please, all the topics in each of the courses from first year, if I have time, maybe another class, remind me, I will break down the courses you are expected to write in your council exam. I will break down the courses and break down the papers first, and break down each of the courses that make up the papers. From first year, you write 6 papers, and each of these papers has courses under each of the papers that cut across first year to final year. So grab your curriculum, all the topics under each of these papers, courses. Make sure you study them, you digest them if you want to do well in your council exam, because questions you selected in all these topics, they are not sparing any topic. So it's not a time to relax and be hoping on what the lecturer give you. Now you are studying from first year to what? Final year. Is that clear? Is that clear? By God's grace, if I have time, I'll see what I can do to help in my own meeting. But I sent you anyway. Let me not go there. Let me continue my class. It's not in this class. It's not part of this lecture. All right. So please, it's preferable to store them. Whatever container you are using or jars should be amber. You know what amber is, right? Do you know why we store in amber jars? To do what? Protect from what? Sunlight. Very important. Please, the label must bear for external use only. Whatever you want to add a label, don't fail to put for external use only. Before one human being will go and open it and put in the mouth. Are we together?
Yes, sir.
So let's use these few minutes remaining to see some answer some questions, and I will call it a day. Is that clear?
Yes.
In our next class we enter paste. In our next class we enter what? Paste. So let's look at some questions before our time elapses. Question 1. Which of the following best defines ointments? Which of the following best defines ointments? A. Liquid preparations applied to wounds. B. Semi-solid preparations applied to the skin or mucosa. Wait now, calm down too. C. Solid medications intended for oral administration. D. Powder drugs dissolved in alcohol.
B.
Yes, I agree with you. The answer is what? B. Semi-solid pharmaceutical preparation that are designed for topical application to the skin or what? Mucous membrane. That's ointment are semi-solid pharmaceutical preparation that are designed for what? Topical application to the skin and what? Mucous membrane. Option A says what? What did the option A say? Liquid preparation. This one has no business with what? Ointment. Is that clear? You can be going to lotions and other things. Then C says what? Solid medication. This one is for tablets and capsules, right?
Yes, sir.
Or powders, as case may be, right? This says powder drugs dissolved in alcohol. This one is tincture. You know about tincture, right? Tincture are dissolved in what? Alcohol. Please know that point. This one is for tincture, not for what? Ointment. Tincture. In tincture, everything is dissolved in what? Some of you that patronize those that carry all those things in their head. So some of the things that carry in their head are tincture. They use alcohol as the word vehicle. So them are tincture. I've told you my issue with them. My issue with them is that they are not standardized, and some of them are not hygienically processed. That's the issue. That they are not standardized. You don't know the strength of what you are taking, and it's dangerous. Yeah. Because some of the active ingredients that are carrying are potent. You don't know the amount you are consuming. It's not by shot. Before they tell you to take 5 ml, 10 ml of a medicine as a dose, they have calculated how many milligrams that should be in that 10 ml. When did they do that calculation? And they say take 2 shots. What is shot? You are taking risk. That's the issue. Apart from the hygiene aspects, you are killing your internal organs without knowing. Because you don't even know how potent what is inside is. So some have mixtures of potent active ingredients you don't even know about. Who studied it? And they say, you know, they tell you it works. Good, it works. Do you know the effect it's having in your system? You don't know. It will work, yes. If you are given, if this table is a glass table, right? If this table is a glass table, right?
Yes, sir.
And we have mosquito perched on this table. Do you know I can kill mosquito by just targeting it and tapping my finger on mosquito to die?
Yes.
I can even kill mosquito by getting a light hand fan and place on and hit the mosquito to die, right?
Yes.
Do you also know that I can kill the mosquito by getting a very big hammer? Are you aware? I can still kill the same mosquito by getting a very big hammer and hit on the mosquito. It will die. 3 of them can kill the mosquito. Yes. But after killing the mosquito, what is the effect on that table, glass table? Do you now understand where I'm going to?
Yes.
This is where you come in as pharmacy professional. What is the effect on that table after killing the mosquito? The hammer will scatter the table. In fact, sometimes the mosquito may even escape, and the hammer will destroy the table. These are what these things do to your system. Your body is the table now. That thing you are killing, you want to fight, is inside your body. Choose what you keep your body safe, at the same time curing the disease. So think twice before you take anything you see on the streets. All right, let's continue. I feel like continuing. All right, one more question, we'll go.
Yes. 2 more questions.
Which of the following is an example of anti-acne medication used in ointments? Medication used in ointment. A. Anti whatever you want to call it. See it here. A. Neomycin. B. Resorcinol. C. Betamethasone valerate. D. Benzocaine.
Neomycin.
Anti-acne.
No,
Anti-acne. I say anti-acne. What is acne in the first place? Let's start from there. Do you know? Posterioritis. All right. Our time has elapsed. We'll stop here. Me, tell the answer. Liar. Tell me. tell me tomorrow. Do it as assignment. Tomorrow, in our last class, I asked a question. Last question, I dropped. So did this one again. Look for it in the next class. Before we start, you tell me, give me the two answers. Option A says. It's something with that thing you wrote on your book. I said, which of the following is an example of anti-acne medication used in ointments? A. Neomycin. B. Resorcinol. C. Betamethasone valerate. D. Benzocaine. Don't tell me. Tomorrow you tell me. Alright, see you to any question. Thank you very much. See you in the next class. My attendance, please. God bless you.